Hello, my name is Dr. John Kempton. We train and coach dentists and dental teams how to implement an oral systemic platform into their dental practice. The key word is implement. This is what we know. Most all of dentistry knows there is a connection between oral pathogens and some systemic disease. Many dental practices have gone as far as telling their patients the connection exists, and in fact showing them a very nice chart or graphic that there's a connection between an oral pathogen and some systemic distant part of their body. Very few practices have implemented specific clinical practices into their daily routine that in fact deliver an oral systemic platform to each of their patients every day. What we do is fundamentally simple. We train dental teams to first identify and treat high-risk pathogens in high-risk patients, to ultimately minimize the impact of high-risk chronic disease like heart attack, stroke, and diabetes. Today we're in mid-Michigan and we're going to interview a dental team that was recently trained on how to deliver an oral systemic program by changing or adding to their current clinical practices. A few things you might want to know about this team. They get excited about doing great dentistry for their patients. They're from a very blue-collar community. And they had been very faithful telling patients that there was in fact a connection between oral pathogens and systemic disease, even showing them beautiful charts and graphs to drive the point home. Finally, there were skeptics among them. So let's meet this team.
It's been a very good way for us to keep our practice healthy. We're seeing more and more preventative services as well as mainly periodontal services, and our patients come back over and over again because they know it's so important. We're finding fewer and fewer no-shows, and I think that the satisfaction in knowing that our patients are being really well cared for means a lot to me, and I think they have a great deal of trust in us as well.
When the oral systemic program was presented to our practice, I didn't really know how our patients were going to react. It was easy to present the material, the connections with the mouth and the body, and their subsequent visits actually proved to me that they were very interested.
I've seen bleeding points eliminated, and with patients they have a peace of mind knowing that the bleeding's gone, things are changing. Teeth that were once hopeless, there's actually a chance of holding on to. The peace of mind that they have is the biggest thing that we take away. It's been a really great experience seeing patients better their total health.
Hello, my name is Lori and I am a periodontal patient. I'm also a dental assistant that has been in practice for 24 years, and I've always lost ground with my periodontal disease. I love the fact that oral systemic health has come into my life. I encourage you to talk to your patients, talk to them frankly, talk to them from your heart. That's what I do with mine.
I currently practice dental hygiene with a dental team that has implemented oral systemic medicine in the hygiene department. And I have to tell you, after 27 years of practicing dental hygiene, I finally feel like I have a tool that helps me individualize treatment for my patients with periodontal disease by targeting the bacteria that was keeping my patients from healing after performing traditional root planing and scaling only. The results I'm seeing from utilizing saliva testing has sparked a passion in me and has brought back for me my purpose as a hygienist.
I guess I'll start out by saying that we've been beating our heads against the wall trying to fill the hygiene schedule, and we always seem to have openings that we just couldn't fix. And in all the coaching and articles that we read in journals said you have to create value for us. And it wasn't until we implemented the oral systemic health program in this practice that that value was truly established in the patient's minds. This program has made our patients healthier, resulting in a healthier practice. I can't recommend this program enough. It has transformed the hygiene department in my practice.
Here's a bottom line. Incorporating oral systemic practices into your hygiene program changes everything. Changes patient relationships, changes treatment plan acceptance, changes periodontal disease outcomes from day one, changes systemic impact of periodontal pathogens on your patient's heart, pancreas, brain, unborn children, just to name a few. It will change your practice and the perceived value of your practice in your community. Finally, implementing oral systemic medicine means you understand oral systemic health, and that will change and empower you forever. Join the movement. Contact us. The process of change is so much easier with an experienced coach and just the right roadmap. We look forward to hearing from you and thank you for your time.